we are, first of all, forming partnerships with prosthetic NGOs in the United States and in the UK, as I mentioned earlier in our previous conversation, to provide free prosthetic devices to amputees in remote areas in Ghana. So we normally do manual prosthesis for such patients, but like this time we decided to go the extra mile by making an electronic kind of prosthesis for her. So basically, she uses her muscles around the amputated part. Research can be exciting and can be stressful.
Yes.
That's what I always say. I always put exciting first before stressful.
Hi, everyone. Welcome to today's episode of Let's Talk. Again, I am excited to host our guest for this episode, Eugene Ablordeppey. In our previous video, he shared with us his experience in finding his path into science. He also shared about some of his achievements, his organization, most especially talked about his organization and some of the challenges that he has come across in his path to becoming a scientist and the things that has kept him persistent. If you haven't watched that episode, go watch it. I know you are going to be inspired and motivated as you listen to that episode. So on that note, I would like to welcome Eugene again. Welcome, Eugene.
Thank you so much for having me back, Emelia. I hope our previous conversation and this one will help inspire your viewers. And I will also encourage your viewers to like, subscribe, and turn on post notifications in order to stay up to date with your postings and also learn from the wonderful, inspiring people you invite to speak on your channel. So thank you so much for having me back.
Thank you. So today's episode, we'll be talking about medical device development. For the sake of our viewers who are non-scientists and may be wondering what the terminology medical device development is, how would you explain that concept?
Yeah, I'm happy to explain what medical device development entails. So medical device development is a process of turning a medical device design into a commercially viable product. I'm sure you'll be wondering what a medical device design is. Medical device design is a process of designing a device intended to be used for medical purposes. So in general, there are a few key steps that takes place during medical device design process. It begins with identifying a need among a specific patient group, and then translating those needs into engineering matrices. So over here, what I'm saying is, you go to for instance, you go to the hospital, you identify a need in the hospital. Then as an engineer or a scientist, you translate that need to physics or biology or chemistry phenomenon, like something that you would understand to make a medical device. So that's the first step. Then you kind of create a first concept prototype of a design. Then the next step is the next step in the medical device process is to put the design through a proof of concept phase to ensure that all the critical design features are feasible and will function as intended. And that's really important. Then following that, then testing will take place throughout the medical device development process. it's really important for you to like continuously test it, because it's someone's life that someone is going to use this device, and you don't want to like make something that it's not functioning well. Yeah. And there also comes like the regulatory pathway. So normally the regulatory pathway is at the last end of medical device design process, but nowadays people try to like start the regulatory pathway as soon as. Yeah, that's the FDA. So normally we say FDA regulation. So people must be aware of medical device development, because medical devices have a direct impact on patients' health and well-being. There's a lot more to medical device design and development than just coming up with an idea, building it and selling it to the masses. It's a complex process and filled with regulations and specifications, application requirements, user needs, and that must be like kind of carefully followed in order to produce a safe and effective product that will kind of succeed in the market and that will save lives. Because you don't want to make any device that would that's not functional and it's not effective and can lead to people dying. Yeah, especially let's say you are developing a device that will monitor someone's blood pressure in the ICU, blood pressure or vitals, any other vitals. If you don't design something that produces the accurate result, you end up getting, call it false positives, or end up getting like bad result, and that's someone's life. Yes. On life support, and the person will end up dying. So it's very critical. That's why there's FDA that you have to follow. You have to comply to all FDA regulations. Yeah.
Wow. So come to think of it, there are so many medical issues, and I am sure you have come across some, if not many. What are some of the medical devices you have developed to help your patients or to help people that you have encountered?
Yeah, so I've developed a few medical devices, and as I said earlier, it's a long process. It's a long process. So I've developed a few. Some, I think one or two I've gotten to kind of FDA kind of approval stage. Yeah, which when you get to that stage, I'm not conversant with FDA regulations that much, so people take charge of that. Yeah, so to answer your question, I've developed a few. When I was doing my master's, I developed a device. I'll say the haptic feedback glasses for easy navigation of the visually impaired. So people who are partially or completely blind have issues with navigation. So my team and I, we developed a device that will kind of give them like vibrational feedback of like where to, if they are, let's say, 2 meters away from, or I'm just saying something like few meters away from like hitting an obstacle. That device will kind of give them feedback, vibrational feedback that, or you should turn left, you should turn right or something. Yeah, it's people needed that. So we developed a device to help with easy navigation. This did not get to the FDA stage. It's still a research that's being conducted in one of the research labs that I work in Arizona State. Yeah, so one of the devices that I also developed when I was in Arizona State University is a real-time monitoring of preterm babies under kangaroo mother care. So let me break it down for you. So preterm babies are babies born before their normal due date. We call it the gestational period, like they were born before the 37 weeks of gestation. Yeah, so, and you know, in Ghana, we lack incubators. We don't have enough incubators to support this fragile kind of babies. So my team and I, we developed a low cost, we call it kangaroo mother care, whereby when a baby is born, when a preterm baby is born, instead of putting a baby in an incubator, we put it on a baby's torso. According to research, it helps with the baby's kind of growth. So we developed a device that integrates kind of sensors. So when you put a baby in an incubator, you measure the baby's oxygen saturation rate, the baby's temperature, the baby's pulse rate and stuff. So basically that's what we did. We integrated all the sensors in the kangaroo mother, we call it the wrap. So we put a baby on the mother's torso, then we wrap the baby with all the sensors integrated to monitor the baby's vitals. So that's exactly what we did for that project. It's dormant right now, but we are still working on it. My team, we've not worked on it in a while, but we are still, it's something that we will pursue later on. And another device that I developed back in Arizona was a point of care malaria diagnostic device. You know, it's really important to diagnose malaria at an early stage to prevent like severe malaria. You know, people die from like severe malaria. So I worked with one of my research professors to develop a point of care malaria diagnostic device. It was at the research stage when I left. So it's important to identify the stage at which you kind of detect the malaria parasite, and that will help with our diagnosis. Yeah, and my master's was also developing a medical device. I developed a real-time audio feedback for people living with Parkinson's disease. So people with Parkinson's disease have problem with walking and like problem with their posture. So I developed a device that would use audio feedback of their posture and their pace. So it's also being it's also in the lab right now, in that phase right now. Still working on it. Other graduate students are still working on it. And one important device that I helped develop and I'm really proud of is the N95 mask decontamination system. That was done in Virginia Commonwealth University by a huge team, and we are proud of this particular device. So basically, when COVID started, we were all struggling, you know, right? We had challenges with masks. People were not getting masks. They had to reuse masks and stuff. So a team from Virginia Commonwealth University, a team of engineers, a team of business people, like people from entrepreneurial programs and stuff, and doctors and surgeons, we all came together to work on this system that will use UV rays or UV light to decontaminate the mask so that healthcare workers can reuse it. And that solved the problem of mask shortage back in 2020. You know, we all experienced that. And one thing, the last thing I'll say is, so this is like not a new device, but like this is what my company does. We work on prosthesis, we work on orthotic devices. These are not new devices, but we work on, they are all medical devices, right? We work on these devices to help people who are living with amputations or people who are suffering any form of mobility issues or deformities. So we make prosthesis and orthotic devices for the people. So these are a few like kind of medical devices I've developed in the past. Yeah.
Wow, awesome. I'm so excited you talk about all these wonderful devices you have made to controlling some of these medical issues out there. So what would you say are some of the challenges you have had to deal with when it comes to your research? Or we can also look at this at a broader angle with most people that are in this field of studies. What are some of the challenges you are primarily faced with?
Okay, yeah, so as you already know, research can be exciting. and can be stressful.
Yes.
That's what I always say. I always put exciting first before stressful, because I don't just scare people. But the fact is, it's stressful, right? Yeah.
Yes.
The process of developing medical devices is a painstaking process. So before you can release a product into the market, you have to consider many factors. And most of the factors are considered during the research phase, because you have to do a lot of research before you even start making a device. Yeah. So, and you have to consider, even after making a device, you have to consider the requirements that you have to follow to meet like the strict FDA regulations. That's another phase of like the challenges that medical device developers kind of face. Yeah, so like the research phase is one big thing, like the challenges like you face during research is one big thing, like trying to come up with a device or the concept behind the device is one challenging thing that we usually face. And even after developing a device, even during the device development phase, like making a device, designing it itself, everything, it's another challenging thing, because it's a back and forth process. You do this, it's not right, it doesn't fit your user needs. You have to like design it again and stuff. So it's a painstaking process. It's a back and forth process. You can call it a challenge though, but it's a learning experience. So yeah, so it's a challenge. It's a challenging for mostly medical device developers. So yeah, researching like this field, it's involving and it requires a lot of effort. Yeah. So even though it's challenging, you have to put in more effort. Yeah.
Yeah. So now let's talk about the exciting part. What are some of the fascinating results that you have, or fascinating improvements you have seen with your research, or some patients that you have handled?
So I'll talk a little bit about my business, the prosthesis and orthotic devices that we make. I think recently, so mostly what we normally do is manual prosthesis for those who don't have their limbs, those who have like completely lost limbs, or so we call this the upper limb, and the lower limb is the leg. Yeah, okay. So we make like manual prosthesis for them. And recently, one of our patients, a kid, lost her upper limb. I think it was below the elbow, right? So we normally do manual prosthesis for such patients, but like this time we decided to go the extra mile by making an electronic kind of prosthesis for her. So basically, she uses her muscles around the amputated part, which we call the residual limb or the stump, to kind of control the limb, right? The artificial limb, like kind of a robot style, like, yeah. It was really fascinating. It's not something new that we did in our company, but it's already been done. It's already been there, so we adopted it. And to add to it, like biomedical engineering, especially in medical devices, rapidly kind of growing. It's a rapidly growing field. And people are coming up with innovative and we call it disruptive, like medical devices. And one of the fascinating one to still with prosthesis, I think my master's PI is involved in one of these projects, is a nerve innervated upper limb prosthesis to improve functionality. So instead of the manual one whereby we fit on you and you do everything manually, or the one I talked about where you use your muscles to activate a robot to pick up something or use it. This time it's surgically innervated, whereby like you use fine wires to connect the person's nerves at the residual limb where the hand or the arm was chopped off. I shouldn't say that, but I'm trying to like, yeah. So use nerve to kind of connect fine wires to kind of connect the nerves to the prosthesis, and that improves like functionality. It's not something that's already in the market. It takes years. I think he mentioned like it took almost like more than 10 years to come up with that project, to come up with that medical device, and they are still in the research phase, not even close to. I think they started the FDA. But they are not close to like finishing FDA regulation and everything. So such devices are not in the market, but in the future, we'll start seeing those devices. Yeah, so there are a lot. These are just an example I gave in prosthetic field. There are a lot of innovative devices out there, like improving devices that will help improve healthcare. Yeah.
Beautiful. So, before we conclude, I would like to ask, and I'm sure our viewers would also be curious to know, what are some of the things you are doing right now? I know you talked about a few with your organization and also with your program, but you are free to tell us how some of these projects you are doing now are going, and some other things we should be expecting from you in the near future.
Yeah, so currently I'm working on a couple of medical device related projects and like testing of medical devices. Yeah, I'm unable to discuss the kind of the specifics of these devices due to intellectual property concerns, and these are like things I'm doing in my lab right now. But I'm happy to talk about what my startup is doing. Yeah, we have a lot of projects ongoing right now, and like planning our future projects, and we are really excited about all these projects. So we are first of all forming partnerships with prosthetic NGOs in the United States and in the UK, as I mentioned earlier in our previous conversation, to provide free prosthetic devices to amputees who need this prosthetic devices, but they cannot afford it. They don't have enough money to afford it, and these people are mostly in remote areas in Ghana. You know, prosthesis it's expensive. Yeah, and you know, the average Ghanaian, or let me be specific, the average amputee, Ghanaian amputee cannot afford such prosthesis. So we are putting in a lot of effort to make sure we reduce the cost of production and the selling price of this prosthetic product in a range that they can afford. Yeah, so we are working hard and tirelessly to make sure like that the Ghanaian market can afford our product. Furthermore, we intend to conduct community outreach programs. It's really, really important to do that in order to screen people. When I say people, I mean amputees who have limb loss, and then fit them with prosthesis, particularly people with upper limb prosthesis. So these are all free initiatives. There's no cost involved. They are not supposed to pay anything. Even they don't come to our clinic, we go to their homes because we know that they don't have enough money. They don't have the means to travel long distance to our clinic for us to fit them. And you know, they're also handicapped. We don't want to subject them into like harsh conditions where they have to like find public transport to come to our clinic. We don't want to do that. So it's an initiative whereby we go directly to their homes and we do everything for them at their homes. Yeah, so it's an initiative that I'm excited about, and my team is really excited about, and yeah, we'll keep things going, and I'll provide you with updates on where we are. We're also working hard to raise more funds. You know, all this I'm mentioning, it involves money. Yeah, we are trying hard to raise more funds for this community outreach program that I'm organizing. So I've participated in like competitions to win funds for this initiative. Like, and most of my most of the competitions that I participated in, they are all in Arizona, in the Venture Devils program in Arizona. So I've had enough money from the MasterCard Foundation, my sponsors, those who sponsored my undergrad and masters in Arizona State. They have this initiative whereby they give money out to scholars to support their initiative. So I've had, by the grace of God, I've had enough funds to work on this initiative. And one last thing I'll say is we intend to expand our services to other parts of Ghana. Right now we are serving Accra and a few regions around Accra. So yeah, we are planning on expanding our services to other.
Yeah, bring some to Kumasi.
Yeah, definitely. Upper West, Upper East, all parts of Ghana. We are all parts of Ghana, and as we are also planning to expand our services, not only prostheses, not only orthotic devices. We want to introduce like assistive devices for people like stroke patients, spinal cord injury patients, to help with their daily life, anything that can assist them to do anything that they want to do, activities of daily living, anything that they want to do. It can be just holding a comb to comb their hair, any device that can help them with even knife for cutting, for people with stroke and stuff. Yeah, so we are trying to expand our services, like things that the medical devices that we produce, the services that we offer, and also reach out to more people in Ghana and even outside Ghana. So we have a lot planned out. Yeah, we have a lot planned out, and they are all exciting projects. And yeah, I'm happy to update your viewers and anyone who is interested in following or getting to know what my business does. Yeah.
Great. So that was going to be our last question, but as you were talking, one other question that I thought of is, if someone is interested in supporting your organization, what ways they could be able to do that? Or if someone is, how can people participate or help with some of the outreaches you do?
Yeah. You can support. It's not like an individual thing. I'm trying to take credit for my organization. No, it's something that I want people to come to join and volunteer. Anyways, like it can be supporting financially, it can be volunteering your time. As I speak right now, we have some volunteers working in the company right now, volunteering your time, even prayers. We need all this. We need your prayers, we need your time, like to help. If you are a healthcare worker, you can join our outreach team, like to reach out to these people. We don't only reach out to these amputees in remote areas. We try to also send the gospel to them, right? So it's really important, and we are really passionate about all this. And yeah, so if anything you can do to support us to reach more people, you are welcome to join us.
Great, awesome. And I would also make sure to keep the email address of the organization as part of the details in the bio. So if you want to reach comprehensive rehabilitation services, do make sure to check the bio, and I'm sure you would get the contact details to be able to connect with them and get to do some of the wonderful things that they are doing. Eugene, this has been a wonderful session with you. I am so glad you were able to come and talk about your organization, your personal experiences, and motivate young people out there. To our viewers, thank you for staying till the end. I hope this was a great and a learning episode for you to be able to know what medical device development and some of the devices that, by the help of Eugene and other scientists, we've been able to have so far. So I hope you enjoyed and learned a lot from this session. Until our next episode, let's enjoy science together. Thank you.